Peptic ulcer disease. A peptic ulcer is an open sore or raw area in the lining of the stomach or intestine. There are two types of peptic ulcers, the gastric ulcer and the duodenal ulcer. Gastric ulcer occurs in the stomach, while duodenal ulcer occurs in the first part of the small intestine. Causes of peptic ulcer. Ulcers are caused when there is an imbalance between the digestive juices produced by the stomach and the various factors that protect the lining of the stomach. Symptoms of ulcers may include bleeding. On rare occasions, an ulcer may completely erode the stomach wall. A major cause of stomach ulcer is the bacteria called Helicobacter pylori. Treatment regimens for the ulcer's cause. This bacterium usually include medications to suppress the stomach acid, as well as antibiotics to eradicate the infection. The following factors raise your risk for peptic ulcers. First, drinking too much alcohol. Regular use of aspirin, ibuprofen, naproxen, or other non-steroidal anti-inflammatory drugs or NSAIDs. Smoking cigarettes or chewing tobacco. Being very ill, such as being on a breathing machine. Radiation treatments, and stress. Symptoms of peptic ulcer. Small ulcer may not cause any symptoms. Some ulcers can cause serious bleeding. Other symptoms include feeling of fullness and problems drinking as much fluid as usual, nausea, vomiting, bloody or dark teary stools, chest pain, fatigue, vomiting, possibly bloody, weight loss, ongoing heartburn. Exams and tests. To detect an ulcer, you may need a test called an upper endoscopy or EGD. This is a test to check the lining of the esophagus or food pipe, stomach, and first part of the small intestine. It is done with a small camera, flexible endoscope that is inserted down the throat. This test most often requires sedation given through a vein. In some cases, a smaller endoscope may be used that is passed in the stomach through the nose. This does not require sedation. Treatment. Your healthcare provider will recommend medicines to heal your ulcer and prevent a relapse. The medicines will kill the H. pylori bacteria if present, reduce acid levels in the stomach. These include H2 blockers such as ranitidine or Zantac, or a proton pump inhibitor (PPI), such as omeprazole and many more. Take all of your medicines as you have been told. Other changes in your lifestyle can also help. If you have a peptic ulcer with an H. pylori infection, the standard treatment uses different combinations of the following medicines for 7 to 14 days. 2 different antibiotics to kill H. pylori. PPIs such as omeprazole or Prilosec, Ianzoprazole or Privaxib, or esomeprazole or Nexium. Prevention. Avoid aspirin, ibuprofen, naproxen, and other NSAIDs. Try acetaminophen instead. If you must take such medicines, talk to your provider first. Your provider may test you for H. pylori because you take these medicines, ask you to take PPIs or an H2 acid blocker, prescribe a medicine called misoprostol. The following lifestyle changes may help prevent peptic ulcers. Do not smoke or chew tobacco and avoid alcohol.